The way people are aging is going to be very different. So I think for us as a healthcare system, there is also a need for us to adapt the way we work.
So actually we are leveraging on technologies and innovation so we can improve on a patient's experience, patient safety.
So a reason why I chose nursing and I'm still really enjoying nursing is actually because of the diversity. So the diversity of specializations I can explore, diversity of people I work with, and diversity of people I can interact with and care for.
One of the things that we have been building up in the past couple of years is bringing healthcare to the mobile devices. And I think right now, if you were to visit the polyclinics or any of these specialist outpatient clinics, you'll be able to access your lab reports, your appointments on a mobile app.
Every year, we will actually have close discussions with our industry partners. That's why then the intake size, etc., will also be adjusted accordingly as well.
So I think one of the major qualities is really your passion and how you want to contribute to the healthcare community.
Sometimes you cannot solve the 20 condition that your patient has, but what you can do is really empathize and put yourself in your patient's shoe.
Often people can be in a fragile situation, perhaps immediately after experiencing a traumatic loss of function, and therefore having very good people skills is very important.
In terms of future of nursing, currently we actually use medical device integrations.
Or when we speak to our nurses or doctors, we find out what programs are necessary to bridge their knowledge gap.
Because we are the only pharmacy school in Singapore, we are always thinking about how to deliver the best program for our students.
So I managed to attend an overseas healthcare course on global health in London because of the MOH scholarship.
End of last semester, I carried on with my virtual clinical exam. And it was definitely a one-of-a-kind experience. The pandemic struck really swiftly and very harshly, but I'm very impressed as well with the student support that UniSA has been able to provide me.
Because OT is about really targeting activities or roles that are meaningful to you and really getting a person back to those roles and those activities. So I think that was something that's particularly meaningful to me, the focus on functioning your daily life.
I actually trust the work of our healthcare a lot, and I can see the kind of effort we put in.
But I think moving forward is about the community also playing a responsible role in this.
I'm very thankful that I made a new bunch of friends. They all come from different areas, but all with the same intention, just to take care of the residents, to work together as a team. It was because of all these people that we managed to pull through this couple of months to help with the pandemic.
The impact that you can have caring for your senior throughout the last part of their life, which is, I think, what differentiates community care, say, from that of the care that's been provided through the hospital.
Therapists also use a wide variety of equipment to help us to better support these patients, as well as to offload some of the physical demands of the therapist. We also provide training to all our new staff so that they know how to safely and effectively handle these patients.
What does really ageless senior means, right? It's basically someone who continue to live life meaningfully and have the potential to contribute into the life of others as well despite their age. Some of them may need some kind of support or help, as they get older, but it really does not stop us from applying this person-centered care philosophy on those we serve.
The first thing is to build up a good impression, not just the elder, but also their family, because the family is going to be your largest source of information.
We are an ecosystem from center-based to home-based to residential-based. And finally, we journey the last lap with the elder in the nursing home. So I guess all spectrum that we cover in St. Luke, it provides so much of opportunity to enrich the life and enabling life of our elder and our caregiver.